Bhupendra Kumar. I'm working as assistant professor in the Department of Medicine, All India Institute of Medical Sciences, Bilaspur. Uh, I have been working for last 15 years in the field of medicine. So today, the very important topic which I'm going to discuss with you all is diabetes mellitus and the risk of heart disease. So we all know diabetes is becoming very common. In every house, we have got one or more patients of diabetes. Nowadays, this is very common, and younger people are becoming patients of diabetes mellitus. So, what is diabetes? Basically, this is high blood glucose levels in the blood. So, but this is not only the high blood glucose levels in the body, it affects many organs, right from the eyes to the feet, and mainly the cardiovascular system, that is heart, is affected by diabetes. So, whenever you have a high blood glucose level in the body response is in a normal person is to release the insulin so that the blood glucose it is taken up by the cell to use or to store. But in case of diabetes, in the case of type 1 diabetes, there is deficiency of insulin, and in type 2 diabetes, the insulin is not effective. So persistently, the high blood glucose level is there in patients of type 2 diabetes mellitus. So how does a heart attack occurs? Heart attack occurs because of the blockage of circulation to the heart. It may be partial or complete. So it leads to the heart attack, that some part of the muscle of the heart is dying because of lack of blood supply. So how does diabetes increases the risk of heart attack? Because in diabetes, when there is a persistent rise in the blood glucose levels, it leads to several changes in the endothelium of the blood vessels, the blood vessels which are carrying blood to the heart. In those vessels, there is formation of atheroma, which is the storage of the fat cells, fat into the endothelial cells of the blood vessels, making the vessels more and more narrow. And second, there is dysfunction of the endothelium also. The endothelium of the blood vessels that comes damaged because of the diabetes. Apart from that, diabetes people they have got usually the high cholesterol levels. The high cholesterol level again predisposes a person to uh, risk of the heart attack. So it is seen that more than 65 years of diabetic patients, most of them, out of them, 68% of the patients, they die because of the heart attack. So ultimately, most of the patients of diabetes, whether they develop any kind of complication in their life, in the future, the ultimate cause of the death is cardiac death, that is heart attack. And in world over also, overall, the heart attack is becoming the leading cause of mortality or leading cause of death. So what can we do? What shall we do? Whenever you are diagnosed with type 2 diabetes mellitus, we should take care of your blood glucose levels, and we can remember how do I take care of my blood glucose levels or my diabetes mellitus. We can remember simply by ABC. That is A for A1C. A1C is just a test, HbA1c, which usually gives us an idea of about blood glucose levels of average 3 months. So we have to keep it in target. Around 7 is the target, which is required to have a lower risk of having organ damage, any kind of organ damage, be it heart or kidney and stroke. So we have to control A1C, A. Then B is blood glucose, blood pressure level. Blood pressure is to be controlled because high blood pressure, whenever there is a high blood pressure, we can understand by simple thing that whenever the blood is flowing at a higher pressure inside the blood vessels, it is damaging the blood vessels. And most of the blood vessels which are damaged, they are brain, kidney, and heart. So again, heart is involved. So BP control is good. C for cholesterol. So cholesterol is to be controlled. Apart from that, we have to maintain the good diet. So in maintain the management of type 2 diabetes mellitus, we don't have to control the blood glucose levels only. We have to look for the heart disease also. What is the risk of heart disease? What is the level of cholesterol? What is the BMI of the patient? What is the eating pattern of the patient? So what is the stress level of the patient? Is the patient is having the habits like smoking and drinking also? Because it all together, they all increases the risk of heart attack. So one by one, we have to tackle. I have talked about the diabetes mellitus, that ABC of diabetes, A1C, blood pressure, and cholesterol. We have to control. After that, the eating habits, we have to increase the high fiber diet, like the vegetables, salads, legumes, pulses in the diet. And we have to reduce the refined carbohydrate, like white bread, like the bakery products, the packed food, the processed food. that all increases the risk of the high blood glucose level as well as the cholesterol levels. Apart from that, we have to shift from saturated fat to the unsaturated fats like sunflower oil, olive oil, or the other oils which are like cottonseed oil. These are they are having the omega 3 as well as the unsaturated fats as compared to the butter or ghee. So we have to decrease the refined carbohydrate and the saturated fats in the diet. Apart from that, we have to maintain a good weight. We have to reduce our BMI. It is recommended that we should go for the exercise which is simple. They can be aerobics, they can be simple exercises like jogging also. The lightweight, the body weight exercises, at least 30 minutes in a day and for 5 days in a week. It is recommended. And so that we can maintain a good BMI, we can maintain a muscle mass, which is helpful to maintain the good cardiovascular health. Apart from that, we have to take good care of the medicines also. We have to take the regular medicines. We have to consult the doctor every 2 or 3 months. That is to be done. Apart from that, we have to maintain the good lifestyle. We have to quit smoking. If we are a smoker, that increases the risk of heart attack as well as the stroke. So we have to quit smoking, and we have to moderate the amount of alcohol if we are consuming. Then after that, last but not the least, that the stress of any kind, it increases the blood pressure as well as the glucose levels also. So we have to have a sound sleep of at least 7 to 8 hours in a day. We have to sleep at time. We don't have to take much of the stress of any work. We have to try to wrap up our work well before the 8 p.m. And after that, we should go to bed. That it means that early to bed and early to rise formula will be best for a diabetic patient. And apart from that, we can do yoga also and meditation to decrease the stress levels. Apart from that, we can indulge ourselves in the physical activity, the sports, or some sort of the group activities so that we can reduce our stress levels. So this is all recommended to control the blood glucose levels, blood pressure, and cholesterol levels. So maybe this information will be helpful for you. Thank you very much.